Tell us about your vision of the future, and in particular, where you think congenital heart disease is going and what part of that future path you could help lead.
I think we now in a bit of a turning point, and I hope it's a turning point. And so now we at the stage where we have to move forward, and the way to move forward is to have a absolute best management for these conditions. We have to understand that we cannot play one thing, procrastinate, try something, and then try something else because it doesn't work. Everything has to be programmed. We have to have care pathway that is super clear. And I think that if we enforce that and spread that out in the community, we can gain a benefit. Then the other thing is we have to innovate. We have to have the courage to try new things. And right now, because of the medical litigation, the spirit we have, pediatric cardiac surgery is paralyzed by fear. The people are afraid of trying new things. And we have to change that. And I think that with the collaborative spirit that happens now, we might be able together to change this. But it's going to be very difficult for one person in one corner to change that. We have to do that all together. And that's the challenge for the years to come. But I think we are at a turning point. The other thing that happens right now is that there's two other things. We have created a new population of patients, is the patients with adult congenital heart disease. And we're just starting to understand how to care for them and look after them. And so there's new operations that are on the way for that. And then we're starting to understand that we have focused for most of the history of pediatric cardiac surgery on hearts. We've tried to have them surviving, not having too many operations. But the life content of the patient is not limited to their hearts. It's about their psychology, how they feel, what they achieve in life, their physical capacity. We have done close to nothing to make them fit. We just said, oh, you had an operation on the heart, don't do anything. And now we're realizing that it's all the opposite. We should train them, physically train them, so that they're in a better health condition and live longer and better. And so we're going to have to start to have a holistic care of congenital heart disease. Look at their brain, their muscle, everything, not only the heart.